Hi everyone. Today I have come up with very important topic which most of the people knowingly or unknowingly keeps ignoring. Your oral health and relation with your body parts. So your oral health is more important than you might even realize. It's a gateway to your overall health. Did you know your oral health offers clues about your overall health? Or problems in your mouth can affect the rest of your body? So protect yourself by learning more about connection between your oral health and overall health. Now let me tell you something about oral disease. So what is gum disease? Initial stage of gum disease, you will find red or swollen gums that bleed when you floss or brush, and gingivitis. When it is not treated, it leads to periodontitis. So what you'll find in that? You will observe loosening of teeth, exposure of tooth's root, and it can lead to tooth loss if untreated. Now, in this picture, you can differentiate between healthy gums and a diseased gum. So, what happens in the mouth does not stay in the mouth. Now, you might be thinking, how is oral health related to overall health? Or could Alzheimer's begin with bacteria that can cause gum disease? Or could the bacteria behind gum disease cause cancer? The answer to the question is yes. So, what problems could poor dental health cause? It leads to dental decay, bad breath, tooth loss, gum disease, diabetes, mouth cancer, heart disease, strokes, lung conditions, pancreatic cancer, pregnancy complications, infertility issues, and many more. Now, diabetes. So, diabetes and periodontitis, they have the two-way relation. People with diabetes can have tooth and gum problem more often if their blood glucose stays high. High blood glucose can make tooth and gum problems worse. You can even lose your teeth. Smoking makes it more likely for you to get a bad case of gum disease, especially if you have diabetes and are age 45 or older. Now, if you have any or more of these problems, you may have tooth or gum disease from diabetes. That is red, sore, swollen gums, bleeding gums, gums pulling away from your teeth so your teeth look long, loose or sensitive teeth, bad breath, a bite that feels different, dangerous false teeth that do not fit well. So diabetes and your oral health is basically a cycle. If you have diabetes, you are up to 3 times more likely to develop gum disease. Now what should you do? High glucose levels in your saliva can help bacteria thrive, and hence it is important to brush and floss regularly. Once plaque has accumulated on your teeth and gum line, it can cause chronic inflammation and infection in your mouth. So regular cleaning and checkup is a must. Now heart disease. Did you know your heart health is connected to your oral health? A healthy mouth is a good indicator of overall health. Conversely, an unhealthy mouth could indicate serious health problems. Periodontal disease does not just affect your gums, it also affects your arteries and your heart. Now, the link between gum disease, heart disease, and a stroke. Research indicates gum disease may increase risk of heart disease and stroke. People with gum disease are twice as likely to have heart disease. Brain injury caused by a blocked blood vessel are more likely to have gum disease. There is no crystal ball, but the presence of common problems in the mouth, that is, gum disease, cavities, missing teeth, were as good at predicting heart disease as cholesterol levels. Liver disease. The oral cavity is a reservoir of more than 700 bacterial species. These bacteria, especially periodontal bacteria, can spread through blood and reach further organs. The most important function of liver is to remove bacteria from blood. Therefore, bacteremia produced from periodontitis could be a serious source of infection to the body in persons with liver disease. Now, infection with periodontal pathogens is associated with progression of atherosclerosis. Fatty liver disease, one of the cause of atherosclerosis. Periodontal disease may also cause non-alcoholic fatty liver disease. Correlation may exist between patient with periodontal disease and liver disease. Alzheimer's disease. So, chronic inflammation causes tissue damage including brain tissue. This can contribute to development of brain disorders. Patients with periodontal disease at an early age had a higher incidence of Alzheimer's disease. Connection between chronic systemic inflammation and degenerative brain disorders. Now, pregnancy, I have discussed in my previous videos too. So, some of the complications are miscarriage, premature birth, low birth weight. Infertility issues. Women with gum disease took on average 2 months longer to conceive than women without gum disease. Periodontitis caused systemic inflammation that could interfere with fertility, possibly due to preventing ovulation, preventing implantation of the embryo, or not sustaining its implantation. Breast cancer and oral health. Gum disease increases risk of developing breast cancer. Women may be 11 times more likely to develop breast cancer if they have poor oral hygiene. Now, how is men's health related to gum disease? 85% of adults in US have some degree of gum disease, but did you know the impact goes far beyond your mouth? Men with signs of gum disease have higher levels of prostate-specific antigen present in prostate cancer. Bacteria that cause gum disease are also found to increase cholesterol and inflammation in heart arteries. Men with a history of gum disease are 14% more likely to develop cancer than men with healthy gums. 53% of male patients with erectile dysfunction also suffer from severe gum disease. Now, men with gum disease have higher risk of certain cancers. 54% are more likely to suffer from pancreatic cancer, 30% blood cancer, 36% lung cancer, 49% kidney cancer. So, are you a smoker? Here are a few of the ways smoking can directly impact your oral health and which in turn affects your overall health. They are tooth discoloration, inflamed salivary gland, bad breath, leukoplakia, oral cancer, bone loss in jaw, increased plaque. Risk from smoking. Smoking can damage every part of the body. Now, cancers associated: head and neck cancer, lung cancer, leukemia, stomach cancer, kidneys, pancreas, colon, bladder, cervix cancer, chronic disease, stroke, blindness, gum infection, aortic rupture, heart disease, pneumonia, hardening of the arteries, chronic lung disease and asthma, reduced fertility, hip fracture. So, be mouth aware and look out for the signs and symptoms of mouth cancer, as mouth cancer can strike in a number of places including lips, tongue, gums, cheek. It's extremely important that we all know what to look out for. Ulcers which do not heal within 3 weeks, red white patches in the mouth, lumps or swelling in the mouth or head and neck area. If in doubt, get checked out. Early detection is crucial. If any of these signs are noticed, please tell your dentist immediately. So now you all must be knowing answers to all this. Did you know gum disease increases the risk of head and neck cancer? Tooth loss and gum disease increases risk of Alzheimer's disease and dementia. Bacteria in your mouth travels to other parts of your body in your bloodstream. Gum disease increases pancreatic and kidney cancer by 62%. Diabetes and bleeding gums increases your risk of premature death by 400 to 700%. 93% of people with gum disease are at risk for diabetes. Pregnant women with gum disease have only 1 in 7 chances of giving birth to a healthy child of normal size. Research has found an association between gum disease and rheumatoid arthritis. People with gum disease are twice as likely to die from heart disease and 3 times as likely to die from stroke. The Surgeon General reports that at least 80% of American adults have gum disease. So without good periodontal health, you can't have good general health. Now, how dentists can help you. So, improving oral health reduces systemic infection and inflammation, allowing the body to heal itself. Eliminating oral infections may lead to disease reversal. So, you can modify your lifestyle in order to prevent these diseases. The key to reduce your risk are stress management, balanced diet, exercise, drink enough water, and have a healthy sleep. So, what are the dental hygiene tips? So, in day to day life, we give all things importance, but we forget our dental health. It is necessary to check your habits and effect on dental health. So, some dental hygiene tips are proper brushing, flossing, avoid tobacco, drink lots of milk, enough water, don't forget to clean your tongue, avoid sugar, switch to fluoride mouthwash, avoid constant snacking, don't use your teeth as tools, visit your dentist twice a year. So, now you all must be knowing your mouth is the mirror of the body. Your mouth reflects the health of your whole body. So, kindly take care of your oral health and overall health. And stay safe. Goodbye. Thank you.